brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Ever suddenly open your eyes and see stars or floaters, or realize that your vision is suddenly blurry and you're not seeing 20/20? Well, tonight we are talking about common visual problems, and here to answer all of our questions on this topic is Express Care's Dr. Jitka Lom. Thanks for coming in, Doc.
Hi.
So what causes causes common visual problems? Like, for instance, you might close your eyes and then you open them, you see black and these white spots. Let's start with that one first.
Okay. Well, vision is really a miracle. It's the pathway of light. We see light coming into our eyes. First, it has to get past the eyelids, so even something like a droopy lid or a swollen lid will interfere with our vision. Then we have the front of the eye. That's our cornea. That's the covering, and you can get a scratch on that and have an impairment. Then you get to the pupil or the iris. That again has to be working perfectly to let the right amount of light through. Then you have the jelly of the eye. Then you have the back of the eye called the retina, which are cells that absorb the light. And then they pass that all to the optic nerve, which is a nerve that then travels to the brain. So some people even see the eye as an extension of the brain, really. And so all along the way, you can have different things that occur. From when you said flashing lights, things, those are actually not visual. Those are things that occur in your brain, just cells firing off, and you think you're perceiving light when you're not really. So many things can interfere, and it's important to have an idea of where the problem might be.
All right, so let's talk about when you have blurred vision. What causes it, maybe? I'm sure there's probably many things, but what are some of the most common reasons why somebody's vision might be blurred, just from normal vision?
Sure. So one of the most common reasons is getting older, because as we get older, it's harder for our lens to accommodate and make the light focus on the back of our eye. So around age 40, people start doing this with their menu and noticing that they need reading glasses. So that's one very common reason. And on Guam, a very, very common reason of blurred vision is diabetes out of control, because when our sugar is very high, it'll affect the way our eye can see. And so if you're overweight or you haven't been checked for a few years and you're starting to get blurry vision, it's a time to get a checkup on your blood sugar.
How do you know if your blurry vision is something that's more serious and that it's time to go to a doctor?
Well, sometimes just when we're tired, our vision might not be quite right. But I think if it's something that's lasting more than a day or two, you certainly need a checkup, because blurry vision is pretty much always something that needs to be investigated.
Now, I was reading as I was researching this topic that there are different kinds of eye doctors. Some eye problems, you can go to your normal physician. Others might require an optometrist, an ophthalmologist. Can you break it down for us?
Yeah, sure will. So if you're having a problem, your first stop is the optometrist. And they're in the shopping malls, and you can just go in and have a quick eye checkup. It's usually about $20 or even less to have a quick checkup on your actual vision. So that is the type of person that will just tell you your vision's okay or not okay and prescribe glasses if necessary. Ophthalmologists are physicians who have specialized in diseases of the eye, such as glaucoma or cataracts or hundreds of other diseases that can affect the eye. And they might prescribe you eye drops or even do laser surgery or prescribe certain lenses or do a type of operation on you if you require that. So, and your family doctor's there to kind of point you in the right direction, maybe help you if you have pink eye, or screen your children if they have a visual problem.
Okay, now what are blind spots and what causes them?
Blind spots are really scary. There can be several causes, but generally they are something that must be taken very seriously. A common reason, again, is with diabetes. In the back of the eye, there will be some swelling and some overgrowth of blood vessels, and then that interferes with the way that the cells are picking up the light. So that's treated with laser. There's another condition called macular degeneration. The macula is the center of the optic nerve where most of the information comes in to the brain, and that one can degenerate, and then people have blind spots as well. And then people can also experience this from high blood pressure, from having small strokes in that area. So there are many causes, and again, it should be investigated very carefully.
Now, you did touch on this earlier about seeing stars or floaters. So it's not actually that you're seeing little stars, but it's maybe something from the brain that's registering through your vision?
So there's two separate things. Floaters are interesting because when you see a floater, you're actually seeing something that's within your own eye. So in your own eye, you have some jelly. We call that the vitreous, and that is always circulating. It's like a jelly inside the globe. That's always circulating, and sometimes little pieces of it can get a little thicker, like a jello that just thickens up a little bit, and it'll float by and you can see it traveling, and it's in no way dangerous or harmful. It just happens and it'll pass after a few days. But seeing showers of light or sparkles or that kind of thing makes a doctor think about two things. One is migraine headache, and that's when your brain is just firing off and your brain cells are sending messages that isn't related to the outside. Mm-hmm. Or sometimes you can have what's called retinal detachment, where your retina just sort of unfolds off the back of the eye, and then people will see showers of light, and that's a very dangerous sign. So if that's happening to you suddenly, again, it's time for a checkup.
All right, well, good to know. Thank you for that, and we will pick up our discussion on common visual problems when Healthy Living returns. Stay with us.